today. Thanks for coming. My name is Wiiliam Rains, and the general purpose of today is to introduce myself and to introduce my informative topic. 1 year ago today, at the age of 39, I had my first heart attack. When I was younger, I was always a small, skinny guy. People picked on me. My clothes seemed to be too big on me. I just wanted to be heavier, okay? Being compared to the size of a spider was a normal joke for me. So at this point, I knew I had to do something. There's probably people in this room that can relate to my story, whether you're too small, too skinny, or overweight, too large. So 1 year ago today, at the age of 39, I had my first heart attack. Now today I will tell you about my need to gain weight, to the need to fit in with others, and one that has cost me a lot of time and a lot of money and heartache. As a young adult, I went off to college. I saw a lot of different body types. Thinking back to when I was a teenager, when I was smaller and skinny, the memories flooded, and I had to gain weight. I needed to do something. So I was eating junk food. I was eating junk food 2 to 3 times a day in order to gain weight. I needed to get lots of empty calories in me. And yes, I supersized everything. I would start drinking these weight gainer shakes, things to gain weight from the health store, anything to gain weight. But there was one thing I didn't do. I didn't exercise. Because why? I didn't want to. I didn't want to exercise because the exercise was going to make me lose the weight I was trying to gain. So it didn't occur to me that I was setting myself up for a lifetime of problems. Today I've told you about my obsession with trying to gain weight. And in doing so, misguided importance. 1 year ago today, I had my first heart attack. So in closing, at the website, Should I Gain Weight, are other examples of other types of people that are in similar situation to me. Now next you're going to hear from my informative speech on cardiovascular disease and ways to prevent it. The general purpose is to inform you of the topic cardiovascular disease. Agencies around the world are trying to educate people of the harmful effects of cardiovascular disease and ways to prevent this deadly disease. Everybody, appease me a second. Everybody close your eyes. Okay? Everybody close your eyes. I'm going to tell you a story. Imagine a person getting ready for work one day. They are going through the motions of getting dressed. They're catching a glimpse of the morning news. They walk into the kitchen to grab that last cup of coffee. As they walk into the kitchen, they feel tightness in their chest and they stop. The pain gets worse until they can't breathe. So they sit down on the couch holding their chest, trying to let this pain subside. But it doesn't work. It keeps getting worse and worse. This person is having a heart attack. Now they are in the emergency room having a cardiac catheterization. Now take another look at that person lying in that hospital bed. Can you see them? Now this person is you having that heart attack. That is you lying in that bed. This was me 1 year ago lying in that hospital bed. All right, open your eyes. I wanted you to get the feel of being in that situation. For many of us in this room, cardiovascular disease could be a reality and not even know it. Without education, we can be subjected to this horrible disease. Agencies around the world are trying to educate people of cardiovascular disease and ways to prevent it. Today, I will talk a little bit about cardiovascular disease in general, risk factors involved, and ways to prevent it from affecting you or your loved ones. First, let me start out by saying and defining cardiovascular disease and basic facts of the cardiovascular system. The term cardiovascular disease really doesn't refer to one specific disease. It encompasses a whole lot of things, including hypertension, heart attacks, and congenital heart disease, just to name a few. According to the American Heart Association, every 34 seconds a person in the U.S. dies from heart disease, and over 60 million people have high blood pressure. Now, of these 60 million people, 35% of them do not even know they have cardiovascular disease. Next, we have heart attacks. Heart attack is a collection of symptoms experienced. Symptoms such as angina or chest pain, have you heard of it? Pain in one or both of the arms, shortness of breath, and other signs may include cold sweats, nausea, lightheadedness. And finally, we have congenital heart disease. Congenital means existing at birth. You have it at birth. So sometimes we are born with certain heart disease that we are uncontrolled of. Things like aortic valve stenosis or any other valve abnormality. We have no control over this. Now that we briefly understand what cardiovascular disease is, let's move on to some risk factors involved. There are two types of risk factors involved with cardiovascular disease. Ones you can control and ones you cannot control. Controllable risk factors are things that you can do to control it. You have control over it. According to the Mayo Clinic, controllable risk factors include your diet, excessive weight, the use of tobacco, physical activity or physical inactivity. Even poor hygiene can contribute to heart disease. If you didn't know this, having an achy tooth for a prolonged time can lead to heart disease. So, uncontrollable heart risk factors may include, but are not limited to, your age, the sex, your family history, and uncontrollable stress in your life. These are things that you have no control over. So now we're ready to move on to different ways to prevent heart disease. According to the Cleveland Clinic Foundation, there are several ways to prevent cardiovascular disease. The first thing you need to do is to stop smoking. Smoking is the most preventable risk factor for cardiovascular disease. Number 2 is follow a heart-healthy diet. Foods low in sodium, saturated fats, refined sugars, low in cholesterol, all can help to reduce the plaque buildup in your arteries. Your total cholesterol level should be approximately less than 200 milligrams per deciliter. Now, eating foods high in omega fatty acids and fish oils can help prevent plaques from sticking to your arterial walls. Number 3, you need to lower your blood pressure. Your high blood pressure increases the workload of your heart, thus increasing the risk for arterial or cardiovascular disease, and can increase your risk for heart attack, heart failure, kidney disease, and stroke. The American Heart Association states that your blood pressure should be no higher than 130/80. Lowering your salt intake can reduce your blood pressure also. Next is to limit your alcohol intake to 1 or 2 drinks per day. And last, if you're already having heart problems, maintain taking your prescribed heart medications such as your aspirin, your Plavix, and others to help prevent future heart attacks. So let's review. Today we've told you about my story with cardiovascular disease, different types of heart disease, risk factors, and ways to prevent heart disease. Agencies around the world are trying to educate people on the harmful effects of cardiovascular disease. In closing, if you log on to the American Heart Association, you will find tips on to prevent cardiovascular disease and ways to for healthy choices to reduce your chances. And thank you for coming. I appreciate it. And